Good afternoon. Hello, Rhode Island. Happy Wednesday. Good afternoon to members of the press. I want to thank everybody for tuning in today. We're going to be here every Wednesday at 1 o'clock for the coronavirus press conference. There may come a time when we have to do it more frequently than once a week, but right now I think if everyone could just take a little time every Wednesday, 1 o'clock, to tune in, we will do our best to make sure you have all the information you need in order to stay safe and informed around the coronavirus. Also, as a reminder, you can sign up for daily email updates. You can do that at the governor's website, governor.ri.gov. I would strongly encourage you to do that, especially now we are talking about what's going to happen when the kids go back to school. Every Friday, that email will be dedicated exclusively to schools. So if you haven't done it, please sign up for an email, governor.ri.gov. Okay, we have a lot to cover today. I'll ask you to bear with me. We'll begin, as we always do, looking at the data. So I'd ask you please to put that up on the screen. Yesterday, we had 61 new cases, and very sadly, another 2 deaths. So, 61 cases, that's holding steady. Those are the kind of days we like to see. Obviously, 2 deaths is heartbreaking. I had the flags at half-mast at the end of last week to mark the fact that we've lost over 1,000 Rhode Islanders to coronavirus, and we still lose Rhode Islanders every single day. To those of you who are saying the virus is gone, we're through this, we're through the woods, the virus is going to disappear, I want to remind you that people die every day in Rhode Island because of the virus, and we've lost over 1,000 loved ones. It's not gone. It's here. It is here, same as it's always been. We've gotten better at dealing with it. And I would just remind you it's deadly, and I would ask you to be aware of that and follow the rules. Because if you don't, more people will get sick, more people will be in the hospital, more people will die, and these are loved ones these are our friends, family, and neighbors, and we owe it to each other to do the best that we can in order to protect ourselves and our family against getting sick. Okay, I wanted today is the day that my executive order for phase 3 expires, and so I'd like to take the next few minutes to talk about where we are in phase 3 and my plan around where we go from here. If you look at the data over the past couple of days, you'll see a small spike. Excuse me. Today is 61, but you'll see a couple of days above 100. Today we're back down to a below 2% test positive, which is excellent. But yesterday we saw more than 100 new cases and a percent positive of just above 3%. That's concerning. It's not alarming. It's not cause for panic, but it's not what we want to see. We want to be consistently below 100 and consistently below 2% test positive. So we are trying to understand why. Why is this? Why are we seeing this bit of a spike? What's it coming from? As I pledged to you, I never again want to shut down the entire economy. So from here on out, we want to be able to pinpoint what's driving the increases and pinpoint our response to it. So thank you to the incredibly hard work of the team at the Department of Health. They have spent the past week doing a very deep dive into the data and looking very carefully through the contact tracing of more than 4,000 positive cases. So a deep dive into more than 4,000 positive cases to try to identify commonalities and why we're seeing this bit of a spike. And there's one thing in that analysis which is crystal clear. We're partying too much. Social gatherings are too large and folks aren't wearing their masks. We have cases traced back to a house party with more than 50 people and no one wearing a mask, to a baby shower, to a large birthday party in a backyard, to a large birthday party at a restaurant, to pool parties greater than 25 people, no mask wearing, to a sports banquet. And in each of these instances, the patterns are exactly the same. People who know each other, friends and family, more than 25 people, not wearing masks, in close contact for hours, mingling close together, no attempt at social distancing, probably not using hand sanitizer. And we are finding that for each one of these parties, baby shower, pool party, party on a boat, party in a backyard, a celebration for a baseball win, a baseball team's win in a backyard, a barbecue, sometimes we're finding 7 to 10 positive cases for each party. So if you're doing this, I need you to knock it off, because people are getting sick, people are dying, and it's unnecessary. Yes, it's summer. I know you want to have a good time. We all do. But I have friends now whose loved ones are on ventilators. Your right to have a party should not infringe on their right to live. We have to get people back to work. 114,000 Rhode Islanders still are on unemployment insurance. We have to get these kids back to school, and we have to get this virus stable. So if you are one of the people who's been partying on a boat, partying in your backyard, partying around the pool, 20, 25 people, no mask wearing, breaking the rules, I'm asking you to stop it, because you are the ones that are directly putting our state's success in jeopardy. And by the way, it's particularly true for folks who are between 20 and 30 years old. Not just that, but we also see that in the data. So I want to ask you, please, to put the slide up with the metrics that I follow before making a decision about whether we're going to go forward a phase or backward a phase. From the beginning, I have said I'm going to be transparent, fact-based, data-based, and let you know what's going on and why we're making the decisions we're making. So I'm going to do that right now. Today is the end of phase 3. The executive order is up, and so I have a decision to make. Do we go forward? Do we go backward? Do we stay where we are? I want to quickly remind you of the 4 metrics that we look at every time. The slide in front of you shows that we're in good shape on 3 of the 4 metrics. Less than 10% of our hospital capacity is full, which is far below our benchmark for moving forward a phase, so that's great. We're starting to see a slight increase in new hospitalizations, but we're still consistently below where we need to be, half of our benchmark for moving forward a phase, so that's very good. And our total hospitalizations have plateaued over the past 10 days at around 70. So while we would prefer to see a decrease, a plateau is great, is good, it's good news, and certainly we're not anywhere close to doubling. The 4th metric gives me and us some pause. The 4th metric is the R value, and you might hear about this on TV, R naught, RT, rate of spread, rate of infection, R value. Essentially, it's the number of people that one positive person infects. And we have said we want to see that to be 1.1 or lower. We had been below 1 for some time, and we have certainly been hovering at around 1 or 1.1, so, which means every person that's infected would, on average, infect 1 other person. That's where we want to be. We want to be below 1.1 if we're going to move forward a phase. Unfortunately, we're not there. In the past few days, we've seen that number increase. It's estimated to be around 1.3 or 1.4, and we believe that that increase is 100% directly attributable to social gatherings that are too large, with no mask wearing and lots of people close in contact. And by the way, when the contact tracing team calls the folks who are at these social gatherings, they can't remember exactly how many people were at the party. They don't have the list of the names of the people who were at the party. It's these kinds of social gatherings that are really a problem. They're informal, they're not very structured. It's hard to get a handle on exactly how big they are, how close people were you wearing masks? It's a casual environment. They're causing a problem. We cannot move forward to phase 4 because of that. Because the R naught is not below 1.1. It's up at 1.3, 1.4. So based on everything and those metrics, it's clear we're not ready to move forward another phase. We also don't need to move backward a phase. You know, the cases are stable, hospitalizations are stable, et cetera. So today I'm announcing that I'm going to extend phase 3 for another 30 days. I'll be signing an executive order keeping us in phase 3 for another 30 days through August 28th with one change. We're going to lower the social gathering limit from 25 to 15. And I hope you take that seriously. 25 to 15. So if you're having a birthday party or a baby shower or a pool party or a backyard barbecue or neighborhood gathering, no more than 15. Take it seriously. Social gatherings above that level are the source of many of our positive cases, and as I've said, it's just very hard. These aren't controlled, contained events. You know, in restaurants, by and large, restaurants are doing a good job. They take your name, they take your phone number, they do contact tracing, they enforce mask wearing. It's these informal social gatherings that are a problem. So I want to review what this means. All other phase 3 guidance remains in effect. Indoor settings, such as restaurants, have a 2/3 capacity with a limit of 125 people. Outdoor settings have a limit of 250 people, specifically for public events and venue spaces. We know that spread is less likely at these types of events, even with larger groups, because we just aren't seeing the same level of mingling, lack of masks, and close contact. Additionally, the capacity for catered events, and this in particular at this time of year is weddings, that's what's on people's minds, remains at 50 indoors and 100 outdoors. Now I want to say this, if you've already planned your wedding, you know, you have an outdoor wedding planned for August and it's a bit higher than 100, call us, call the Department of Business Regulation, and we want to work with you. If you're just above 100, if you can convince us that you'll have a proper protocol and keep folks safe, we're going to try to work with you to let you keep your wedding and go a bit above 100. We need to get people back to work. We need to allow our children and teachers to get back to school safely, which means we need to control this virus now, which means we're going to stay in phase 3, but social gatherings are now going from 25 to 15, indoors and outdoors. I'll sign that executive order today, and it'll go into effect. I'd like to take a minute to talk about bars, which I addressed last week. So when I began phase 3 and we allowed restaurants to open, including bars, I said that we were in the business of trying to help you get back into business. And we still are. But the fact of the matter is, we've been in phase 3 for a month, and there's no excuse anymore for not complying. You know, the first week or two, you had to learn the rules. Folks really weren't sure how to do it, and we understood that. We've been at it for a month now. We've seen too many problems with overcrowding in bars, and so we're going to really start to increase our enforcement. And quite frankly, it's not fair to the vast majority of restaurants who are following the rules. So the grace period is over, and we're going to start to get tougher with enforcement. If you're not following the rules, we're going to shut you down. Period. We have to. We're going to work with you so you can safely reopen, help you, get things in order so that you can reopen because we want you to be in business, but we can no longer take any risks. And the excuse of, I haven't figured it out yet, is no longer going to be any good because we've been at it for over a month. The biggest problems we're seeing now are in restaurants that have a bar and allowing crowding around the bar. That's how people get sick. I would say to you as an individual Rhode Islander, if you find yourself at a restaurant and you're in a crowd, you should leave. Get out of the crowd. That's how you get sick. If you're in a line, in a line for drinks, you shouldn't be. That shouldn't be allowed. Any crowding in any restaurant is where you get sick. It's not where you should be. So I just want to take a second to remind everybody the Phase 3 guidelines for restaurants and bars. In Phase 3, bars can't operate like bars. Bars should not look like bars. They have to look like restaurants. So if you own a bar or a restaurant with a bar, you have 3 options. Number 1, you can have a bartender, but no bar seating. You cannot have people sit at the bar and serve drinks. Cannot do that. Number 2, you can have bar seating for dinner, food service, but no bartender, because we can't have people close to the bartender. And number 3, you could have a plexiglass barrier between the bartender and the seated customers. Under no circumstances, period, no exceptions, can you have standing service. Someone has to deliver a drink to someone who's seated. And this is what we're going to really crack down on. This is very simple, folks. You cannot have standing drink service, period. It's a bright line rule. Don't do it. And we're really going to start cracking down on that. Drinks can be served, but people have to be seated and distanced away from each other and away from the staff. We'll be sending out more inspectors and cracking down on the bad actors. Last weekend, inspectors went out to just over 150 bars and restaurants across the state. Over a third of them didn't have sufficient separation between bartenders and customers. Over a third. A number of our inspections involved return visits to a restaurant with previous violations. There's just no excuse for that. A dozen of the visits were so egregious that DBR had to issue compliance orders. And for many businesses, that meant immediately shutting down the bar areas until we were satisfied that the rules could be followed. Starting today, we'll be publishing a list of these businesses at reopeningri.com. So if you're a member of the public and you want to know who are these restaurants that aren't following the rules, go to reopeningri.com and check it out. It'll be there on an ongoing basis. By the way, we also want to recognize establishments that are doing a great job, which is the majority, 2/3 or more. So we're going to be highlighting best practices in our newsletters and websites to acknowledge them for their hard work, but also to share their good ideas and creative ideas. If you are out and about and you see crowding at bars or standing service for drinks, help us out and call us. DBR, you can go to the DBR website, dbr.ri.gov, or we've set up a tip line, 889-5550, 889-5550. Call us, anonymous tip, let us know. I will say this, last week at this press conference, I gave a similar message to bars. And after, we were deluged by calls from restaurants that said, Gov, please don't shut us down. We are following the rules. So here's my message to you. I don't want to shut you down. I want everyone to be in business. Massachusetts, Connecticut, other states, their restaurant capacity is 50%. I went to 2/3. I'm trying to get folks to work. I need your help. If you are following the rules, go to reopeningri.com and see the restaurants that aren't following the rules and help us get your colleagues to follow the rules. If it doesn't get better, I'll have no choice. We'll have to do what Massachusetts, Connecticut, and other places are doing and just cut back. And the frustrating thing about that is there's no need to. If we follow the rules, don't allow crowding, enforce mask wearing, do the keeping everybody's contact information, we should be able to keep going. I would say consider this almost like a last warning. We are going to do our part. We're going to increase our inspections. We're going to get tougher with enforcement. We're going to be quicker to shut down operations that are not even trying to comply. I'm asking the people of Rhode Island to do your part, avoid crowding, call the tip line, and I'm asking the Hospitality Association and other restaurants, help us do what you can to enforce the rules on your peers who aren't following the rules, because they're about to ruin it for everybody, and that would be crushing and doesn't have to be that way. Okay, I want to spend the rest of the time talking about schools, but by the way, it's all related, because if we can't get the R naught down and we can't get the virus in a good place, it's going to be harder to open schools. I would say this is a tough one. You know, getting schools ready is a tough one. I feel that as a governor, I feel that as a mother. You know, there's not a mom or dad out there who's not a little worried. Is it going to be safe? What does a mom want to do or a dad want to do for their kids? You want to do what's best for your kids. And the question is, what is best for the kids? So, look, we know that being in school is best for our kids. There's no question about that. We shouldn't even debate that. Obviously, children should be learning in school. It's better for their brain development, their academic development, their mental health, their physical health, their social lives. It's where kids ought to be. And we know our kids are struggling because they missed out on school. They had to. And we see it. We see it in immunizations being down, weight gain among kids, increased suicide attempts, increased depression. It's really tough. So should kids be in school? Obviously, of course. The question is, what's it going to take to make it so that they can safely be in school? And I think this is not that different than the analysis we did for childcare or even school sports. You know, the question wasn't, should kids be allowed to play sports? Of course they should. It's part of their lives. The question was, how do we do it so they're safe? And that's what we have to grapple with schools. And I'll tell you this right now. We're not going to let anyone go back to school in person if it's not safe. Won't do it. Not worth it. Not going to happen. But I'll also tell you this. We owe it to our children to do everything we can to get them back in school. And the question is, how do we do it safely to protect them and their teachers and their families? I want to begin by reminding you what we've done with childcare and the experience we've had, because we haven't really talked about it. So more than 2 months ago, just about 2 months ago, we reopened childcare centers in Rhode Island. So these are, daycare centers for our littlest kids. By the way, these children do not socially distance themselves. They do not wear masks. And anyone who's ever played around with 2-, 3-, and 4-year-olds knows it's hopeless to try to get them to socially distance. Having said that, we put in strict guidelines around group size, symptom monitoring, face coverings, cleaning schedules, drop-off and pick-up protocols, and more. What I want you to know is it's working. You should breathe a sigh of relief that this is working. Child care providers have stepped up. By the way, thank you to child care providers. At first, they were scared to go to work, obviously. They've gone to work every day for months. They're amazing, they're creative, they're strong. Thank you. We have now more than 75% of our child care system open. We have nearly 8,000 children currently enrolled in child care and more than 1,000 adult employees who have been working for 2 months. During that entire 2-month period, over 1,000 teachers, workers, and nearly 8,000 kids, we've had a total of 12 positive cases among the children and 14 among the staff members. In every instance, we caught the case quickly, we closed the areas for cleaning, we tested everybody at risk, and we've seen only 1 outbreak in a center which we immediately closed. We closed the facility. We sent in a team from the Department of Health to do testing and case investigations, ensuring that the majority of the students and staff did not get the virus. So for those of you who are wondering, is this even possible? I would just refer you to the experience we've had for 2 months with childcare and suggest that it is going very well. I have to thank Director Courtney Hawkins for her tremendous work, and I also want to invite all of you to join Director Hawkins and me tomorrow at 3 o'clock for our weekly Thursday 3 o'clock Facebook Live to talk more about what are the lessons we learned from childcare and what can we learn from that to make our schools safer when they reopen. I think it's important for everyone to hear. So if you're a parent, if you're a concerned parent, teacher, concerned citizen, you want to know what's it going to take to safely get kids back to school, I would encourage you to tune in tomorrow, 3 o'clock, Facebook, hear from Director Hawkins and myself. We'll probably have another, I think we'll have another pediatrician with us, and we're going to talk about it. Okay, we are scheduled to start school in Rhode Island in 5 weeks, August 31st. And as I said, our job between now and then is to work as hard as we can so that we will do that safely. It's a Herculean task. I spent an hour and longer than an hour this morning on the phone with all the superintendents. They're all pulling their hair out, trying to figure out how to do this. I think you're trying hard, and I applaud your work. It means we have to think comprehensively about facility readiness, transportation, testing, classroom structure, precautions for teachers, got to keep our teachers safe, staff. It means establishing clear criteria and guidelines and working with school districts to ensure that they are enforced. And it means having a plan ready to change on a dime if we see spikes. So I want to start off briefly by saying where we are here in Rhode Island. Last week, we had 630 new positive cases. That translates to 59 weekly cases per 100,000 people. 59, I want you to remember that, 59 per 100,000 in Rhode Island last week. Florida is at 358 weekly cases per 100,000. Louisiana, 326. Mississippi, 307. If we lived in one of those states, or Texas, or Arizona, or California, we'd be having a very different conversation right now. But if we can keep ourselves at about 60 cases a week or lower, we can have a reasonable, thoughtful discussion around how do we get children back to school. And by the way, 90 countries around the world have reopened schools. So we know it can be done. And many of them, they've opened schools, they've seen no spikes. So it can be done. The question is, what do we have to have in place in order for it to be done? So we have recently put together a advisory board of experts to help us just around schools. It includes Dr. Dennehy, a pediatric infectious disease specialist at Hasbro, Dr. Merrill, Medical Director for Epidemiology and Infection Control at Rhode Island Hospital, Dr. Sharfstein, who's a Vice Dean of Public Health at Johns Hopkins, Dr. Weddle, former Dean of Brown School of Public Health, and Dr. Ashish Shah, Director of Harvard Global Health Institute and incoming Dean of Brown School of Public Health. I name their names because they are volunteering for us and working very hard, and I want to thank them. And I want you to know we are listening to experts as we think about reopening school. What we're going to do is what we've done the whole way. Identify a clear, comprehensive set of metrics and benchmarks that we need to hit in order to be confident that we're ready to reopen schools. And these experts have advised us on what those metrics will be. So I would like you to please put up the slide now. I'm going to go through those metrics. The slide shows 5 key focus areas that will indicate whether it's safe to move forward with most kids in person in school. Number one, we're going to be looking at statewide data to make sure we're continuing to see good trends. We have to be in phase 3 or better for us to even consider having most kids learning in classroom. Number two, we're going to look at municipal readiness. So this is going to have to be very customized, community by community. You know, we know Central Falls, for example, is in a very different place than many other communities. If we see an incidence rate above a particular level in a particular city or town, we're not going to move forward with a full reopening of schools in that municipality. And Dr. Alexander Scott is working with that team of health experts to evaluate exactly what number is most appropriate. And I expect we'll be back late this week or early next week with exactly what that number is. Third, we're looking at testing readiness. Right now, as you know, we're struggling with our testing time. It's still taking too long, on average, to people to get their test results. We need to have rapid turnaround of test results in every school if we're going to be able to safely reopen schools to primarily in-person learning. We need an average turnaround of at least 48 to 72 hours. Fourth, we need supply readiness. Every school has to have a more than sufficient supply of cleaning supplies, Purell, soap, hand sanitizer, masks, you know, whatever is required to keep teachers and students safe. You know, does every school have enough face masks to make sure that every teacher and every student has a face mask on at all times, even if someone left it at home by accident? And finally, we're looking at operational readiness. So this encompasses several key areas, which you can see on the screen. Does every school district have a comprehensive plan with multiple contingencies that was fully vetted by the Department of Health and Department of Education? Do these plans include all safety precautions that were outlined in the 34-page guidance document that was provided to districts by RIDE? They're very comprehensive. Safe transportation plans, plans for social distancing, plans for keeping kids in stable pods, accommodations for high-risk students, accommodations for teachers which have underlying health conditions and pre-existing conditions, et cetera. So these are the 5 areas which are on the screen before you that are going to be our focus as we go through the next 5 weeks to make sure that we can check the boxes in order to say, yes, it is safe for children in this particular school district to return to school in person. And if we don't check those boxes, then we won't allow it. I don't want anyone to worry that you're going to be asked or required to go back to school in person when it isn't safe, because that's not going to happen. We're not going to let that happen. I want to give you a little more information. Currently, on the reopeningri.com website, there's a 34-page guidance document outlining the specific parameters for each of the reopening options. Full in-person, partial in-person, limited, or fully remote. By this Friday, we're going to be posting all the plans for each district in Rhode Island, and Commissioner Infante Green is going to discuss that in a minute. By Monday, we'll be posting additional guidance document for all schools on health protocols, including how to screen for symptoms, how to determine when it's safe for a student or staff member to return to the classroom, and how to support the Department of Health with case investigations. The following week, I'll have more details around testing and transportation. And then the week of August 16th, we'll have our final recommendation on what level of reopening that we expect in each city and town. So what's the bottom line? The bottom line is schools are opening August 31st. Exactly what they look like when they open, we do not now know. We're going to make that assessment the week of August 16th. Between now and then, we're going to be working very closely with every school district to put all these contingency plans in place, and also to be monitoring the level of the disease in every city and town. And you can hold us to the criteria that's on the screen now. And I hope it gives you some comfort that we're not going to let kids go back to school unless and until it is safe. But I also want to point out that everything up here is doable. It's hard. It's very hard, but it is doable. And we owe it to our children to do everything we can to get as many of them back in school as possible. At the end of the day, this will be about choice. We're never going to force a parent to, force their children to be in school. Every district will always have to have a high-quality distance learning virtual program. Our job, though, is to make it so that you're confident enough to send the kids to school. So this is where we are. I would say Rhode Island so far has done a very good job dealing with this crisis. We've done a very good job with summer camp. We're doing a great job with childcare. And I have every reason to believe that if we forget about the politics, forget about what's going on in other states around the country, forget about the president saying we're ignoring the science. Turn all of that off. Focus right here. Children learn best in school. What does it take for this to happen safely? And how do we work hard over the next few weeks to make that happen? Be flexible, be patient, be calm, and let's work according to this timeline, and we'll make final decisions the week of the 16th. Lastly, I just wanted to very briefly acknowledge an announcement I made yesterday. Right now, there are so many people out of work in Rhode Island, and there's fear among many of them that they may never get back to work, especially if you're in an industry like retail or accommodation or hospitality that has been so hard hit. So yesterday I announced that we'll be dedicating $45 million of our federal stimulus funds to train and support 5,000 to 7,000 Rhode Islanders who've lost their jobs in the COVID crisis. I want to thank our congressional delegation again for getting us that money. Here's the important part about this program. There's a guaranteed job at the end of it. This isn't getting training and hoping that you'll get a job. This is signing up. We have a website, Back to Work RI. If you're out there, if you've lost your job, if you're worried you might not be able to ever go back to your job, if you think you desperately want a new job but you don't have the skills, you don't know what you're going to do, go to the website, Back to Work RI. Sign yourself up for it. We're going to get you into training. We're going to give you job coaching. We're going to help you with your resume. And we have dozens of employers that have already promised to hire over 3,000 Rhode Islanders. So sign up, get through it, and there's a job at the end of the tunnel. We are going to rebuild this economy. We're going to get everyone back to work. We're going to get ourselves back to 3.5% unemployment, and we're going to be better and stronger and more resilient on the other side. That is my promise to you.